Good morning. This is the dawn of a new day. This is a time for hope. This is a historic moment. This institution, where we sit today in our capital city in Connecticut, in Hartford, on the campus of Hartford Hospital, we've been here for 166 years. And this is a tremendous moment for our state, for our region, for our country. In speaking with our physicians have described this in many ways for our country comparable to putting a man on the moon. March 13th, I remember vividly being on this campus, being with the governor, being with our staff. We had our first patient who was COVID-19 admitted to this hospital. And we went and rounded and we met with our staff and we talked about, we were prepared for this moment. To imagine 9 months and a day that we could be here with a vaccine, with the level of effectiveness of this vaccine that could be created in this country in 9 months is almost impossible to imagine. Today we recognize 15 pioneers. We have 15 members of our team who are momentarily going to get vaccinated, members of environmental services, respiratory therapy, food services, our physicians, our critical care physicians, our nurses who are at the bedside, all people who have been caring for our community, our patients in this time. I want to recognize their courage, their devotion. This is a calling. I've described throughout this crisis, people who work in healthcare, frontline healthcare workers, they're a different breed. These are people who protect us. And when we're most vulnerable, our moments of greatest need, they're here for us. It's never been more clear, more vivid than throughout this crisis with COVID-19. And in this moment, again, our frontline healthcare workers are going to step up. They're going to show their confidence in the science, their belief in this vaccine. They're going to role model. They will be the very first people in our state, amongst the very first people in our country to get this vaccine. I have enormous gratitude, incredible appreciation, respect beyond that I can put in words for what I see from our team, our frontline healthcare workers every day. I can't describe what it looks like when you're on the floor, when you're seeing the work they're doing for our patients, the caring they do in every setting. Today, the 15 people who will be here represent every segment of Hartford HealthCare, every county in Connecticut, coming forward in demonstrating the commitment to providing safety and protecting this community. This is the dawn of a new day. This is a moment for incredible hope. And I'm so honored that Governor Ned Lamont is here today, and it couldn't be more befitting. You know, I've been with the governor, working with him, supporting him in this effort. His leadership throughout this crisis has been absolutely exceptional. But to me, speaking with him privately on so many occasions and working to respond to this crisis, I've been incredibly impressed with his inclusiveness, the way he listens, his assessment of the situation, and his absolute consistency about being well-intended, always working hard to do the right thing. And his devotion, his commitment has been extraordinary. And I will tell you, Connecticut, the advocacy he has had with Connecticut each week with the federal government, bringing resources here, and then getting those resources to us on the front lines. It's really difficult for me to even fully articulate what he's meant to us, to have the right leader as the governor in this moment. And I can just tell you, my gratitude to you, Governor, has been absolutely incredible, because I can speak to the fact that every week my peers, leaders from around Connecticut who run the hospitals throughout the state, come together, meet with the governor and his team. And the issue is always, what can he do for us? How can he help us? What do we need? What does he need to know? And Governor, this is a great moment for all of us. And it's an honor to be here with you. Governor Ned Lamont.
Hey, thank you, Jeff. Back at you and to all the healthcare folks. You've been on the front line this entire time. On behalf of the people of Connecticut, I'm so appreciative of everything that you have done. I can't think who else deserves to get this vaccine first than the people on the front lines taking care of each and every one of you. As Jeff said, this is a really, really important day. As President-elect Joe Biden might say, this is a big deal. And I'll tell you why. Sometimes it takes democracies in America a while to get going, and we had some false starts early on down in Washington when it came to taking the COVID as seriously as we could. But we are going on all cylinders right now. And the amazing scientific community, from our amazing hospitals here in the state of Connecticut, to Pfizer doing the R&D right down the street in Groton, to scientists all over this country. And what this innovation is, this messenger RNA is incredible. In 9 months, it is one of the most effective vaccines in the history of the world, deemed to be safe and effective. Take it from the FDA. Take it from the British, who have opined on this, take it from the Canadians, and take it from our own vaccine advisory group, the scientific community. We ask them, everybody, to take a look at this and make sure that what you're doing is safe and effective and keeps you safe, keeps your family safe, keeps your community safe. And I'm a bit of a football fan, and for the first time in a long time, Jeff, I think we see the end zone.
Absolutely.
And we got a lot more blocking and tackling to do. We got a lot more wearing the mask to do. We got a lot more being careful to do, especially during this holiday season, especially when people tend to gather and perhaps let their guard down. But to each and every one of you, this is so well deserving. I want to see the first people get the vaccine. I hope I have an opportunity to be soon thereafter. Thank you, everybody.
I'd like to invite Keith Grant forward. Keith is our Director of Infectious Diseases for Hartford HealthCare.
Thank you. So over the last few months, the things that we've asked of the citizens of Connecticut, social, physical distancing, washing your hands, wearing a mask, ensuring you get tested, staying away from family if you have any symptoms. As of this morning, we're going to be able to say, get your vaccine as well. So that's a big deal. That's a huge deal. So from the medical and science community, there's a few things that we hope for. We've hoped for through this entire process: a cure for this wretched disease, and a vaccine, a cure in the form of a vaccine that's 95% effective. 95%, and we speak on this in a number of settings, and one of the most, I think, telling setting is the fact that the flu vaccine has helped exponentially over the last few decades in reducing the mortality for flu. And average flu vaccine efficacy is about 42 to 60%, 45 to 60%. We have a vaccine now that's 95%, and it's not only in theory. We will watch individuals receive the vaccine this morning. So on behalf of Hartford HealthCare, with collaboration with the entire community, there's a number of people that work in the background to make all this happen. Dr. Kumar, absolutely. Cheryl and her team, Dr. Prem Kumar, that's somewhere around here that's in the background. There's a number of people that works tirelessly to ensure that we are able to provide service to our community. But the people on the front line that are in our critical care units, that are in our emergency department, that keep our area clean, we're going to be able to provide 1,950 dosage to these people this morning, starting this morning, to ensure that we're giving maximum protection to these guys, to ensure that they're serving our community. So with that, please get vaccinated when you can, when it's available. Keep safe. And Jeff?
Today at Hartford HealthCare, we have 9 permanent testing locations set up throughout the state of Connecticut, and we have 5 mobile units that we dispatch each day, and we're doing about 30 to 35,000 tests a week. We will continue to do testing. We will continue to accelerate and actually expand our testing capabilities, but we are pivoting this organization today, and we are now building a statewide capability to deliver the vaccine across the state of Connecticut. And to help support that, I want to bring forward our Director of Pharmacy for Hartford HealthCare across Connecticut, Dr. Eric Arlia.
Good morning, everybody. Thank you. It's my pleasure to have been part of today's ceremony of receiving the first vaccines here at Hartford Hospital and to secure them and to begin to prepare for the rollout of the vaccines to our frontline staff. On behalf of the pharmacy team, I'd like to let you all know that our clinical pharmacists have reviewed all of the data in conjunction with our medical staff leadership, and I just want everyone to know that we have tremendous confidence in the vaccine. The process followed good scientific principles. I think the pace at which it was done is really related to this new technology of messenger RNA and just being organized in all of the effort that was put into working through the trial. Our job now is to get this vaccine out to everyone. We are very hard at work at planning our clinics at all of our healthcare facilities, and then beyond that, we're looking forward to helping vaccinate other healthcare providers in our region, and then ultimately to patients in whatever order that the Governor's Task Force Committee decides is most appropriate. I'm also really excited to let everybody know that this is a great opportunity for pharmacists. Pharmacists are vaccinators. I think many people know that from maybe getting a vaccine at your local CVS or Walgreens. Our pharmacists in Hartford HealthCare, I asked them about 2 or 3 months ago to start thinking about being really highly involved, anticipating this moment, and more than 50 of our pharmacists have come forward and have volunteered to help with vaccinations. And I think that's really important, because there's a lot of strain on the healthcare system, as everyone knows, with the surge in patients related to COVID. We want to help our nursing colleagues as much as possible with the vaccination effort, and I couldn't be more proud of our team for stepping up. And our clinical manager, Colleen, will be one of our 2 vaccinators today to help get us started. So again, thank you very much. My privilege and honor to be part of this effort today. Thank you.
This is going to make an extraordinary difference for the safety of everyone working in healthcare today, and it's going to make a tremendous difference for protecting the families and everyone who encounters our facilities. I've invited 2 of our physicians to come forward today who work most closely and have been since day one on the front lines of fighting this virus. And I'd like to ask Dr. Melissa Cumberland to come forward, who's the Director of Medicine for Wyndham Hospital.
Good morning. Thank you so much for allowing me to participate in this momentous occasion. There's only one word that can really describe how I feel inside, and it is excitement. This is something that no amount of training could have ever prepared us for. The amount of resilience, however, that has come from my colleagues and our leadership, I'm extremely proud of, and proud of them, proud of this whole institution. Hartford HealthCare has done an amazing job supporting us through this. And I thank you. I thank you, Jeff, to you and your leadership. I thank you, Governor Lamont, for supporting us. As I said, there's nothing that could have prepared us for this, but we've made it through. We couldn't have seen that the last 9 or 10 months was going to pan out the way that it did, and it has. We are now in a place where we can say this is a day of hope. This is a day of change, not just for Hartford HealthCare, not just for our state, but for our nation. And I thank you. I thank everyone for allowing me and my colleagues to fight this fight with you. I thank you to the scientists that have worked tirelessly, endlessly, to make this come to fruition. I know that going forward, we will be forever able to say we have participated in change. We have been a part of being the first line that has been the leadership, first set of people to get this vaccine for Hartford HealthCare, and I couldn't be more proud to represent my colleagues, my patients, to represent the fact that I believe in science and I believe in our medicine. And I think that today, Hartford HealthCare, the state of Connecticut, has allowed us to do just that. Thank you so much. This is indeed a day of hope, and we will continue to push forward and fight this fight.
And finally, I'd like to invite Dr. Patrick Troy forward, who's a pulmonologist here at Hartford Hospital and has been intimately involved in caring for so many patients in our ICUs during this crisis. Dr. Patrick Troy.
Thank you, Jeff. I'll be honest, I didn't sleep a wink last night, mostly based on just the incredible excitement about this moment coming to fruition. It's beyond my wildest dreams that where we've been and where we are in 9 short months is, I used the phrase before and I'll use it again, I think it is literally nothing short of the equivalent of putting a human being on the moon. It's that momentous in terms of the nature of what we've accomplished. Having said that, I realize that behind me on the 11th floor today, my partners, Dr. Perkins, Dr. Panico, and Dr. Nascimento, are still fighting the fight, along with our nurses, our therapists, and our advanced practitioners, every day treating COVID. And what's changed from now, from the spring to now, is our competency. We are so much better at treating these patients, so much better. And that's a testament to science, to leadership, to innovation, to working hard and working as a team. It's been incredible to be a part of it. There's so much more to do, though. There's so much more to do. You know, throughout the entire time, I have just been awed by the compassion and the character of the residents of the state of Connecticut. And Governor, I think it's largely a testament just to the way you've talked to us as humans, as a kind person. I have been asked repeatedly, Patrick, Dr. Troy, what can we do for you? What can we do from the staff? Whether it's Jerry at the lunch counter or people in a grocery store or even at a gas station, they want to be part of the solution. They want to help. They have brought us lunch. They have fed us. They have brought us masks that they knitted together. They've even dropped off antiseptic wipes at the emergency room. I've been awed by their compassion. I've been awed by their character. You know, when they ask me what more can I do, right? Until now, I basically said, you know, I need you to wash your hands. I need you to wear your mask, and I need you to practice distancing. And those things, by the way, I'm not saying those things need to change. We need to double down on those efforts. But today, I have one more ask. One more ask. And that ask is that when it's your turn to get this vaccine, that you choose to take that opportunity. Having said that, I would never ask you, my patients, my community, this state, I would never ask you to do something that I would not be willing to do. And I think what we've done today is assemble people behind us, right, healthcare providers across the line who are willing to do that, not just to talk the talk about the vaccine, but to walk the walk. And let me reiterate, this vaccine is safe. This vaccine is effective, almost 95% effective, regardless of age, gender, or race. It came out quick, yes, but that's what the governor was talking about because of the technology that we employed to make that happen. Nowhere through this process was safety compromised. So when I say take that opportunity, I think that's the right opportunity, not just for you and for your health as my patients, right? But it's so much more. This is about doing the right thing for the safety and health of your friends, of your family, your neighbors, your coworkers, and your classmates. The more rapidly we work together to get this vaccine into us, the more rapidly we can begin to quickly change the narrative on COVID and get our state back. With that, I'm just incredibly excited and enthusiastic to roll up my sleeve and get this vaccine in me. Thank you.
Thank you. Governor, this is the moment. This is a tremendous step forward for us in the fight against this virus. This is a moment. We now will begin, and we will have these pioneers, people working across all aspects of healthcare, to begin today and get their vaccine. I thank each and every one of you.